we've also then seen a lot of communities coming together to recognize and declare racism as a public health crisis. And we've seen the shift in way people are thinking about trying to solve these large systemic problems with programmatic solutions. And now we are seeing more communities thinking about how can we use policy as another tool in the toolbox, not to replace programs. We absolutely still need those, but how can we think about using the stories and using success stories, but also the challenges that come through these kinds of programs to make the case to decision makers about how and why some policies may need to be adapted or changed or better enforced, and how we may want to think about where resources are going, and how certain programs and certain organizations or certain institutions like public health and healthcare may need more resources to address these kinds of things, because these are huge problems and no one organization is able to truly address them in the way that they need to be addressed to reach the thousands of people that are impacted. So how can we use the stories that you are seeing and experiencing in your programs, or as you're talking to people, in the food distribution efforts, or in the testing lines? How can you collect and use these stories to really communicate the need of the community and the resources that it would take to truly make a difference to those who have the opportunity to make those decisions and get resources into the counties and communities that we are serving here?